Let's do a case review. All right, so here we've got this wonderful woman. As we can tell, massive amounts of decay and wear and just overall missing teeth. Nobody and their dog would do crowns or partials here. But, as you can tell, just, teeth are severely broken. Okay. So when we look at her case, when we look at her pano, we can tell it looks like we've got plenty of bone here, going all the way back to, possibly the molar region. Lots of bone underneath subnasally. And when we evaluate the pterygoids, we've got really a beautiful pterygomaxillary junction here. Very nice, large, wide pterygoids. When we look at our zygomatics, again, very nice, large zygomatics as well. The one thing to note is it looks not very dense. So, same in the mandible, especially on her lower left side. It looks, pretty hollow. Not a lot of cortical bone, just looking like very soft medullary bone that's very wide as well. 16 millimeters wide. So, seemingly very easy case, very straightforward. However, that is definitely anything but. This case here was quite a bit of a challenge, as I hope we can appreciate. We followed the PATZi protocol, doing pterygoids, anterior, a tilted posterior on the right side. However, when we attempted the tilted posterior on the patient's left, there was no torque. Even engaging into the lateral nasal, nothing. We were not able to achieve torque. No big worries. We just went in, opted to do a zygomatic. And nice thing is we're fairly low on the zygoma. There's plenty of room up here to place another one to get to the anterior if we have to. When it comes to the mandible, placed a beautiful 6.0 by 8. We did not have to engage the inferior border. However, we used 16 or 18 millimeter long implants. But notice, however, there was nothing placed over here in the number 19 spot. And so what we're going to do is we're going to go back in once this bone heals and replace one and see if we can't get one to stick better. But all in all, when we look at our different cross-sectional views here, especially looking at the pterygoids, we took out the medial pterygoid plate, and very happy with that result. When we look at our zygomatic, right here, note we go right to that edge, to the lateral edge of the malar, and so our zygomatic implant is just engaging maybe one thread outside. It's not as long as how we see the Brazilians do it, but when we come and we look at our anterior, we are engaged right in to the floor of the nose right there with our posterior tilted. And our anterior ones, they cross right in that nasal crest. So